Welcome to Evidence-Based Answers to Clinical Questions. My name is Melanie Anderson, and myself and Annie Orchanian Chef are going to be the ones talking to you during this session. Annie is going to do a little demonstration for you to show you where to find the pyramid and how to use it.
So to find the pyramid, you go to the UHN virtual library, which is UHNLibraries.ca, and in the one search bar, you simply type in pyramid. And the first thing that comes up to you will be the EBHC Pyramid 5.0. Let me just make that bigger for you. So the EBHC Pyramid 5.0 is a pyramid of information resources where the top of the pyramid, the apex, is the most processed or critically appraised information, and the foundation of the pyramid are individual studies. Every layer of the pyramid that goes up from the individual studies is one more layer of critical appraisal and processing. And so what we've done is we've put links to UHN resources and other resources that correspond to the different slices of the pyramid. And I'm going to demonstrate a question for you today. So you have a patient with irritable bowel syndrome, and they've read on the internet that peppermint oil can be helpful for their symptoms, so they ask you about it. And so you decide to do some searching to see if that's in fact true. So the pyramid apex are systems like Epic, but unfortunately, most of the information resources are bundled in the lower layers of this pyramid. And so we start with layer 4, synthesize summaries, and we work our way down. So I'm first going to show you BMJ Best Practice. BMJ Best Practice is based on disease categories. So unlike UpToDate, you wouldn't put in everything into your search box, but you would put in the disease. So I'm going to type in irritable bowel syndrome, and I see it suggested there. And BMJ Best Practice is an evidence-based resource, and what you're looking for in an evidence-based resource is that it tells you when it was last reviewed, it tells you when it was last updated, that it tells you who put this tool together and what their disclosures are, that it indicates that it has been peer reviewed, and it's helpful to know the disclosures of the peer reviewers as well, and that it actually has links to the evidence. And so we're pretty confident that this resource is evidence-based. And I'm going to go to the treatment algorithm. In the case of our patient, let's assume diarrhea is predominant and pain or bloating is predominant. And so when I look down at the options here, I see one for antispasmodic. And if I scroll down in this section, there is a paragraph on peppermint oil. So if this answered my question, I wouldn't have to do any additional searching. But let's assume that it didn't answer our question. So we'll go back to our pyramid and go down the pyramid to the next layer of the pyramid, which is systematically derived recommendations, which is a long way of saying guidelines. And I'm going to go to guidelines via clinical key. And here, the drop-down menu, you drop down to guidelines, and you type in irritable bowel syndrome, peppermint, because you don't want just any guideline on irritable bowel syndrome. You want the ones that actually mention peppermint. And there's two guidelines that come up, an Italian guideline and a Canadian guideline. So let's go to the Canadian guideline. View full guideline. And I'm going to do Control F to see where peppermint falls in this guideline. And it says here, we suggest offering IBS patients peppermint oil to improve IBS symptoms. Conditional recommendation, low quality evidence. And here is a section that gives the key evidence behind this statement and links to citations. So again, if this answered your question, you wouldn't have to do any additional searching. But let's assume it didn't answer your question. So we're going to go back to our pyramid. And next, we're looking for systematic reviews. And I'm going to go to PubMed. And I'm going to type in irritable bowel syndrome peppermint. Search. And on the sidebar here, you can see that there are filters, and I can filter to systematic reviews. What you want to know about PubMed, PubMed refers to public Medline. So it's designed for the public. It's meant to look very simplistic. You just type in your terms like you would in Google. But there's stuff going on behind the scenes. And to find out what that is, you go to the advanced screen and you scroll down and you look at the details beside your search term. And what you're looking for is that it identified that you have two separate concepts, irritable bowel syndrome and peppermint, and that it found something called mesh terms. These are the index terms that are used in Medline. So you want to know that it found an appropriate mesh term for your concept and that it also made some appropriate keyword searches. So I'm not concerned that it did anything incorrectly here. I'm going to go back to my search and look at some of these results. Here's a systematic review from 2022. Here's one from 2014. And there's others. And hopefully you would find your answer among these systematic reviews. But if you didn't, you would go to the foundation of the pyramid, where, again, you could go to PubMed to do your searching. And I'm actually going to show you something in PubMed that you may not have seen before. If you scroll down on the front page, there's something called clinical queries. This tool uses predefined filters to narrow down your search so that you will get less results and ones that are hopefully more relevant to what you're looking for. So I'm going to type in again, irritable bowel syndrome peppermint. And you can see the filters here are therapy, clinical prediction guides, diagnosis, etiology, and prognosis. We're asking a question of therapy, so I'm good with that. And then I'm going to choose a narrow scope and search. And it says see all results in PubMed. And these are mostly going to be randomized controlled trials. Here's one that's very recent from January 2026. Here's an economic evaluation from 2021. Here's another randomized controlled trial from 2021. And hopefully by the time you've reached the foundation of your pyramid, you found the answer to your question. It's not always the case. Sometimes you have to rely on your colleagues because there is no evidence, but you'll know at least if you've gone through the process whether an answer exists or not.